Hello everyone, my name is Oubai. I am from 4HV and together with Viggo we have made a presentation and in this presentation we're going to talk about a psychotic depression. Now, what is a psychotic depression? A psychotic depression is also known as a depression disorder with its own psychotic features. This disorder has symptoms of psychosis. The main symptoms are losing touch with reality, being delusional, and seeing hallucinations. If these symptoms and the depression itself are not treated, psychotic depressions can be a lifetime threatening. But if a person with this disorder gets the right treatment, it can help with the mental improvement. What are the stages of a psychotic depression? Now, the stages that occur during a psychotic depression, also known as psychosis, are called phases. There are a lot of phases, but there are mainly three. We have the prodrome phase, the acute phase, and the recovery phase. During the prodrome phase, an individual experiences changes in himself. For example, an individual can hardly screen out distracting information or sensation, having a hard time focusing, seeing more brightness, overloaded feelings, and irritability. The prodrome phase is also the first phase. Prodrome syndromes vary from people to people, and that's why this phase can take days, weeks, or months. The second phase is the acute phase. In this phase, the hallucinations, delusions, and vague speaking become very clear in the individual, and people around him can also see that. During this phase, an individual really is in need for medical help. And if I talk about medical help, think about rehab, using medicine, and talking about it with other people. Now, the last phase is the recovery, and this phase takes a lot of time. During this phase, the individual is in medication and the individual becomes better at coping in life. Now, what triggers a psychotic depression? To this day, it is not still fully understood by researchers what causes psychotic depression. However, just like all other forms of depression, the triggering of a psychosis can be caused by the following: sleep deprivation, medication prescriptions, the misuse of anesthetics, an upsetting life event, and because of that upsetting life event, that causes stress, and your genes. People who suffer from psychotic depression tend to have a difference in brain development. According to a study of the PMC, PubMed Central, the dopamine D2 receptors, which are responsible for bringing dopamine to the nerve cells, and controlling the amount of dopamine in the human body, are a lot less active to people with psychotic depression than the average human being.
Hello, my name is Viggo and I'm doing a project with Oubai about a psychotic depression. My topics are: is a psychotic depression bipolar, how to recover from psychotic depression, and how will you recover from it, and also what's the impact on daily basis, how will your day look if you have a psychotic depression. First, I'm starting with: is a psychotic depression bipolar? A bipolar depression is that you have a lot of mood swings, and the one moment you're happy, but if you get triggered by anything, like if you get triggered by literally anything. If you have a bipolar depression, and you will get unhappy and get sad at a moment. It can happen throughout the day or even multiple moments on the day. That's a bipolar depression. A psychotic depression is a little bit different. It's when you see hallucinations and get delusional from things, and also that you're really sad and don't want to be with people anymore. There's a difference between it. It also has some similarities, like you also can get a bipolar part with psychotic depression, like the same things I told about a bipolar depression, but then you get hallucinations more often if you have it both. So most things are different, but also have some similarities. How to recover from psychotic depression? If you have psychotic depression, the best is to tell other people around it, even though you want to be alone. The best is to tell other people about it. You also would likely need to go to a psychologist. They will help you with a lot of things, and they will get medicine for you to recover from it. Most of the patients with a psychotic depression will be recovered between in 2 or 3 months. But if you have a really bad depression, it could be around 12 to 18 months. But that's in a worse part. Most of the times it's just like 2 or 3 months. The medicine they will get you are antidepressants and antipsychotics. The antidepressants will help you with a chemical called neurotransmitters in your brain that will help you with the anxiety and the depression. So you'll get better sleep, and you don't feel, you don't want to be alone anymore. You can talk with people, and it helps. That's the part that will help you with anxiety. The antipsychotics medicine will help you with hallucinations, so you don't see things anymore, and you don't have a voice in your brain anymore. That helps a lot. Most of the times it will you will take 2 or 3 pills a day from both, but in worst scenarios you get 5 to 6 pills a day, and also sometimes sleep pills if the antidepressants doesn't work that well on you. The impact on your daily basis. If you wake up, you don't have the mood to do anything, you just want to be alone in your room all day. You have less sleep, you sleep worse, so you become tired and more tired every day. You also don't want to go to school anymore. You don't have the mood for it. You are really tired the whole day. The anxiety also doesn't help you. Most people with a psychotic depression will also lose many friends because they don't want to be around people anymore. They want to be alone, like I just said. So that's where the anxiety comes from. And a psychotic depression, the hallucinations can come at any moment, at any time of the day. So you have a lot of stress, you're always alert, and most people also get delusional from it. So you don't know what's real or what's fake anymore. That's really, really bad, and it becomes worse. That's why it's so important to take the antidepressant and the antipsychotics to help the chemicals in your brain to be normal again.